Welcome to the CareerSmart learning course on sexual dysfunction. While our society is overloaded with products and discussion related to sex and sexuality, somehow sexual dysfunction is a subject that most people shy away from, particularly in the healthcare field. The purpose of this course is to discuss common female and male sexual dysfunction and some common injury-related conditions affecting sexual activities. This course was designed to benefit the following professionals: nurses, case managers, rehabilitation counselors, and claims adjusters. This course may also be helpful for individuals, family members, or caretakers who are confronted with this problem. At the end of this course, the learner will be able to 1. Define sexual dysfunction, 2. Identify the normal phases of the sexual response cycle, 3. Review clinician assessment of sexual dysfunction, 4. Describe the classifications of male and female sexual dysfunction, 5. Describe the effect of select traumatic injuries on sexual function, and number 6, identify treatment options for sexual dysfunction. Susan and John have been married for 10 years. They met on the first day of undergraduate school and married right before law school. They are both successful attorneys, are physically active, and have a strong mutual attraction for each other. They've always considered themselves happy and lucky to have one another. Things have been more difficult lately, as they've been trying to have a baby for the past 2 years, but have not been successful. Around the same time that they started trying to have a baby, Susan and John were in a motor vehicle accident together. Susan suffered a pelvic fracture, which was surgically fixed with screws. Since the accident, she has had difficulty engaging in sexual activities with John because certain body positioning causes severe pain in her pelvis. Emotionally, she also has a hard time getting excited about sex because of the anticipated pelvis pain, thus leading to a gradual loss of sexual interest. This has affected John as well, and he's been getting progressively depressed. He feels that perhaps his wife is not interested in being with him, and he also fears hurting her during any sexual activities. The young couple is trapped in trying to deal with this problem and longing for a child together. Susan and John's story demonstrates the biological, social, and psychological nature of sexual dysfunction. This is an area often not discussed by the physician as part of the routine treatment plan. Sexual dysfunction is characterized as a decreased interest in sex or difficulties in sexual performance, either due to pain or disturbance in achieving one or more phases of the full sexual response cycle. To meet the clinical diagnostic criteria, these disorders now must last at least 6 months and is persistent, not transient sexual difficulty. The physical realities of Susan's injury affect her aptitude for enjoyable sex and is causing interpersonal stress between the couple. Adult sexuality consists of gender identity, sexual orientation, intention, desire, arousal, orgasm, and emotional satisfaction. Desire, arousal, and orgasm describe sexual function and are part of the sexual response cycle.